This is a demonstration of the Medit i900 mobility scanner with iPad. So this is the iPad software which is simplified to the main Medit Link. You've got 4 buttons on screen here: Express Scan, Treatment Scan, Manage Patients and Manage Orders. The 2 different scan options give you the option to do a quick scan for consultation purposes, or the treatment scan for scanning for a crown or aligners. We're going to do a treatment scan here, so we click in, select the patient and then select our workflow. This will then take us through to the scan stage where we can begin scanning. Down the left hand side you've got your different options for the scan workflow. So you've got the maxilla first, mandible, then first occlusion, second occlusion. To start the scan we're going to press once on the scan button at the top of the scanner and start scanning. You're going to scan the occlusal surface first, and then once you've done that you can roll over and scan either the buccal or palatal surface. You just want to go back over any areas we've missed, fill in those gaps. Once that's scanned we can move on to the next stage. To do this we can press and hold the top button on the scanner and this will move on to the next stage for us, which in this case is the mandible. Then single press again to start scanning. I'm going to scan the occlusal surface first, then roll over, scan lingual or buccal, again doesn't matter which way around you do that. Once that's captured we can then press the scan button again to stop the scan, and you can then rotate using your fingers on the iPad, pinch to zoom in and out, or you can rotate with one finger. We can also do this from the button on the scanner. Bottom button, this is a remote control button, so we can rotate the scan, then press in the centre, it will allow us to zoom, press in the centre again, and we can pan the image around the screen. Once we're happy with that, we can press and hold the top scan button again to move on to the occlusion stage. Here we're just going to take a reference from one side for the occlusion, and it will show in bright green once it's captured. Press and hold the top button to move to the second occlusion, do the same for the opposite side. Once that's done, we can now click View Scan, check our scan over, rotate it round, zoom in on any areas that are important, make sure it's fully captured, and then you can see in the bottom left corner we've got the option to either order or complete scan. If we click Complete Scan, it will give us the option to keep the data as it is or fill major holes, and you can also tick Process Data in the Cloud, which can speed up the scan save. Once that's done, it will take us back to the patient dashboard and we can view that scan once it's loaded and then order it or keep it saved there for future reference. And that's a demonstration of the i900 mobility scanner.